expressed during the program are solely that of Heiar Insurance, not WBEV or Good Karma Brands.
And good morning. It is 11:11. Thank you very much, Wally Lukashinsky. This is Taking Care of Business. Senior Solutions with Heiar Insurance on 95.3 WBEV. Also on Daily Dodge TV. You can check us out there. Make sure you like, subscribe. Anytime we go live, you can get a notification and watch, as you can do today as well. Appreciate you being here. Now, I'm Wade. Matt Heiar is not here today. Sandy Heiar is not here today. Justin Wilski, the Ninja, is not here today, but we have an award-winning panel here to talk about Heiar Insurance and Senior Solutions. Jill Bennett and Leanne Schultz here. Good morning. How are you?
Good morning.
Good morning.
So tell me about, I guess, first of all, how did you both end up on the show today? Because you said you've been on when we've done the radio in the past together, or always with Matt? Or
Not together. No. It was just I've done the show with Matt and with Sandy. Sometimes we even did it from our office during COVID years. But yeah, this is only maybe my sixth time or so. But yeah, live TV though with the YouTube TV, haven't done that before.
All right. Well, I appreciate you being here. I guess the first question I would ask is if somebody has any questions that are not on the air today, what's the best way where's Heiar Insurance located? How do they get in contact with you there? Yeah,
we are located in the Heritage Mall, right next to Joanne Fabric, and they can give us a call. 920-887-0580. We're there Monday through Friday.
So, Jill, you are a veteran of Heiar Insurance, right? How long have you been involved with Heiar Insurance? Tell us your story.
Okay, I've been there almost 12 years now. I always go with the almost add-on. But yeah, part-time. Started my career way back in Green Bay is where I'm from, in banking. So about 9 years before I got married. Banking, and then since then worked with the CPA in tax preparation for about 10 years, and then I mostly been stay-at-home mom with my two sons, so that's my claim to fame. I feel my greatest accomplishment is my children, raising them, but have been with Heiar now and really enjoy working with them.
So when you were in the tax business, this was probably the time, like nowadays it's like what, the fourth quarter is kind of the crazy time at Heiar Insurance. You're in the tax business. Was this just like the time where you started to know that it's going to ramp up, or was it already busy mid-January?
Yeah, really mid-January was busy with the tax season because you were doing all the 1099s and getting all the paperwork ready. So yeah, this was their busy season, but it really ramped up in March,
So what is your exact role here today? Can I explain to everybody what you do at Heiar Insurance again a little bit more in depth?
Yeah, well, I'm a licensed insurance agent there, but mostly customer service, administration work. Do the, answer the phones there and all the bookkeeping too. So I'm just there. I like to say there's nothing there I can't do, so let's put it that way.
So you basically can we just say, because nobody's listening right now, that basically without you, Matt and Sandy would be lost, right?
Yeah.
Is that kind of what it is?
Yeah, right.
You do it all, they take all the credit.
No, we love our Matt and Sandy.
I'm just kidding.
Yeah.
Do you love Matt's mustache?
Yeah, sometimes I forget he even has it. I look at him and I don't even, it doesn't stand out to me.
I had to think about it.
Yeah, I know.
Did he shave it?
No, I don't think he did.
But
that's what I mean. It's like I look at him, but I don't always see all the
He's so
specifics.
dapper, isn't he?
Yeah, he really is.
Now,
but I want to introduce Leanne.
You brought that up last time about having a mustache. They were giving him crap about a mustache.
Yeah, because he's got like a perfect like Tom Selleck mustache.
Yeah, he
Look at
does.
your mustache.
Mine's not as pretty as Matt's.
No.
Matt looks glamorous.
He does. Yeah.
I'm kind of rough around the edges. Now, Leanne, you haven't been here quite as long as Jill, have you?
No, I haven't. I just started in July.
Okay.
I'm just part-time. I used to work for the Dodge County. I did the insurance and benefits for all the employees there.
Okay.
So I'm familiar with a lot of the insurance, but it's been an eye-opening to me we do more Medicare by us rather than group insurance at Dodge County. So it was, I'm learning both ends. I'm learning from group insurance to Medicare, and I like to broaden my...
Yeah. So what intrigued you about Heiar Insurance? So what made you want to join the team?
I do like to help people. That's some of the things I did. And then with the health insurance, I knew quite a bit behind it. But I was getting bored with my retirement. I retired.
Okay.
And so I wanted to get a part-time job. And I used to work with Matt and Sandy. When I worked at the county, I'd send people there
Sure.
to find out
Quite
more about
often.
insurance.
Yeah, very
so
often.
it's kind of nice that he offered. I called and asked, and he called me back and said, "Yeah, come in part-time."
So how long were you retired before you decided you needed to do something?
2 years.
2 years. So it wasn't so long because at one point one of my good friends just retired, and they said it took a little while to realize you weren't just on a long vacation. Did you have that come to reality moment?
Honestly, I'm busier now than I was when I worked.
But you
don't,
could choose
don't
what
be
you want to
thinking
do.
that I wasn't busy at work. But no, I am very busy. I have a lot of different things going on right now with my sister.
Yeah,
and
we hear that from retirees. I mean, we have a lot of retirees, and of course, but yeah, sometimes some people are like, "Yeah, I've never been this busy," and others are like, "I'm just missing something. I just don't feel quite right not going to work." So then they get something part time. Yeah, exactly.
if I find myself sitting on the couch or in the chair too much, then I know I have to get something to. I need something to do.
Yeah.
But I haven't really
haven't
found that
gotten
yet.
it.
So what have you enjoyed since you? And again, how long have you been there again?
Since
Since
July.
July. So what have you enjoyed most about since coming back?
Talking with the people, helping them. I learned a lot about supplements and advantage plans. I used to think that the advantage plans weren't very helpful.
Okay.
And then after reading or going through a lot of the different things that the employees need, I discovered that advantage plans help depending on their income
Okay.
and their health. And it's something a lot different. When you're group, you just have one group insurance. With Medicare, you got two.
So obviously you kind of mentioned, the silly season, the busy season. So once you get past and everybody getting on their plans and renewing them, what typically happens in your office? Well, what goes on like now? I mean, do you have the next
Yeah.
group of people that are starting to meet with you, or typically what are you handling like right now in mid-January?
Yeah, I call January like customer service
Okay.
month because, people's plans changed. Sometimes with the Affordable Care, they're getting a new card with their new plan and new deductibles, new benefits, and they just have to kind of transition into that. So like this past week, we've gotten a few calls on, I got a letter from, such and such insurance company, and they're describing, these changes. I didn't even know I changed my plan, so they're just becoming aware that, oh yeah, that's right. There are deductible changes, there are possible co-pays, and then they get a new card, and just kind of making people aware of the changes. And then with Medicare, the Part B deductible changed for the 2025. It's
Okay.
$257.
So how does that
and-
change from what it used to be, or how does that impact people?
Yeah, I mean, last year it was 240, so
Okay.
it's just a slight increase. But sometimes they're just not aware that, oh yeah, I do still I have to pay that deductible first before Medicare will pay. But just the little transitions into new plans, and that's kind of with group insurance too
Okay.
every year, because our group insurance always changed too, right? When we were on group, those benefits every year, you kind of pick a different plan.
Sure.
So it's not all that different, but yet it is different. I feel like people feel like it's so different from group, but
Well, maybe somebody doesn't. Can you explain the difference? What is group? What is? somebody's listening and they're
Leanne,
not sure.
maybe you know more about the group
Leanne, can I
part.
talk about the difference? You said some people don't know the difference between group insurance, or explain what the differences are.
Well, the group insurance we have, depending on the amount of people you have or employees that you have working for you, it depends on the dollar amount. It also depends on utilization, how much utilization they had as group insurance, and then the dollar amount is based on that. With ACA, it's based on your income. Group insurance isn't based on your income. They just have the insurance through the company that you're going through. Some of them could be that you're paying the full amount, but with the Dodge County, the county picks up a lot.
Okay.
And it's the summary of benefits could be different from ACA to group insurance. Sometimes it's less. You don't pay as much for your premiums. For your, or definitely not for your premiums, but for prescription drugs could be cheaper. When you have a a supplement or you have Medicare Advantage plan, you may be paying a lot more for your drugs. But they have a $2,000 limit. Then the employees, the people don't have to pay anymore after $2,000. With group insurance, you could be paying a lot more than that.
Okay. This is Senior Solutions Program with Jill Bennett, Leanne Schultz in this morning on 95.3 WBEV and Daily Dodge TV. If you do have a question, you want to give us a call, you can give us a call at 885-4446 or send a text at 920-887-9595, and we'll gladly take those questions. So typically, Jill, are you usually the first contact with somebody at Heiar Insurance? Typically, when the phone rings or you check your email, what are like some of the questions, the first things that you read or you hear from somebody when you pick up the phone?
Oh, they just start with, I don't know anything about Medicare.
It'll be me in a few years.
Yeah, you don't look like you're going to be a few years.
Thank you very much.
Yeah, you don't. Actually, I just began Medicare this past September, so if anybody's wondering, has questions, I'm a newbie at it, but I can definitely tell you it's good insurance. So, but yeah, that's the call. They just feel like, oh, I just don't know anything about this, but really, they're not supposed to know anything. They've never done that Medicare before. It's it's different than their group insurance. They're used to just going to their HR person or to Leanne for insurance, but now so they just want direction, and I think that's where Matt comes in. I mean, people are just he's so trustworthy. They've heard, my neighbor so-and-so told me to call Matt or Sandy, and so there's just that trust and reliability and somebody they know factor when they call, and they just want to sit down, talk it over, get comfortable, and get educated. I think that's Matt's role. Really just does a great job of letting people know what their two choices are. There's not that many choices. It's a supplement or an advantage plan, and what are the differences, and as long as a person knows what they're getting into, they can feel comfortable then when they make their choice.
Sure, and again, it's one of those things where, that's a good point you make. Like I said, now you have insurance, and what do you really do? You have some sort of a conference call at the beginning of every year if your insurance is the same, and here's what my deductible is, and you just pay the bills when they come in, and at least try to pay the bills. And now when all of a sudden you're retiring, it's like a totally different animal. Do you think people like I'm 50?
Yeah.
I haven't really paid attention to what my insurance is very much. Just know that because you really don't have a choice. You go to an employer, and all of a sudden you have choices, don't you? When you all of a sudden you get to that 62, you have that choice.
65 is Medicare age, but you can take your Social Security at 62. Yeah,
those are questions that people probably call and ask.
Right. Yeah, the Social Security Medicare thing. A lot of times they kind of mix and match those. But 62 you can start Social Security, but you do have to wait till 65 for Medicare unless you're disabled. There is Medicare disability available if you're younger and disabled. But those are the kind of things. Other questions that people always have, drug plans are a big deal too. You need a prescription drug plan, and you can get penalized if you don't have credible drug coverage. So they always hear of the penalties available in Medicare, and that scares them. When you're working and on group insurance, as long as your insurance is credible with Medicare for the prescription drug, you don't have to worry, and you won't get penalized because you'll have a special election or opportunity to get off of your group and go on to Medicare. So, you might still be working, turn 65, you won't have to worry.
I'll be working when I'm 65.
That's 15 years.
Yeah, I'll be working when I'm 65.
Okay.
I'm in the wrong. We're in the business where I'll work till I'm probably 100.
Oh my gosh!
Keep working until you're 100.
Okay, yeah. I mean, it's not a bad thing.
No. So when you said you went on, so did you feel like you knew? Did you have a lot of questions? Did you go into Matt's office and all of a sudden start asking the questions that people are asking you when they call in?
No, I knew what I was doing when I turned 65, and I did my own enrollment on Medicare.gov, took care of that, and then Matt helped me sign up for a supplement. So, I felt pretty confident after those long that I knew what I wanted and felt educated. And just always listening to Matt, all his one-liners are always running through my head. I can repeat some of them, but But
What are his one-line? What are Matt's one-liners?
oh, there's no right answer here is
Okay.
a good one. And
that's
smoking
true.
Yeah.
mirrors.
Very
yeah,
true,
very
very true.
true.
Because is it the right answer the right answer is right for probably different for everybody.
Right,
Isn't it?
it's
Yeah.
different for everybody. You know, kind of depends on your health, where you want to be when your health changes, and not just your health now, your health when what's in your family.
Sure.
You know, what are your genes, and then affordability and your own comfort with what you want going forward. I personally feel like I've saved money, and it's going to be for my health insurance because I want to. I'm into fitness.
Yep.
I'm into taking care of myself, and whatever the cost, I feel like that's a priority for me.
Excellent. Now, Leanne, what's your typical day like? Are you in the office all day? You said you're part-time, or
Nope, I only have to come in half a day. But during open enrollment this year with Medicare, I was there long days.
Yeah.
It was one after another, and it was. That's why it's kind of like open enrollment for your group
okay?
insurance.
Yes.
Starting in January.
Okay.
But this is open enrollment, and you know there are so many elderly that they don't know what's going on, and I really do feel for them because they don't understand how their medications have changed, and they want all the new drugs that are out, and they are a lot more expensive than what you would pay for the older drugs that did the same thing. You know, we have a couple of them that we tell people to go to Canada and buy
Okay.
their
Yeah,
drugs
we
from.
talked a little bit about that too, and how you can get your drugs in Canada. It's how the way the system is right now, and you can get them. Save yourself lots and lots of.
But I don't know if they're still on strike.
Yeah,
Because I
okay.
know a lady
Okay.
went and did hers, and
Okay.
a month before they went on strike, and she still hasn't gotten them.
How does that work though? When if you're getting your drugs through Canada, they mail them to you. Do you have to go to the border and go buy them, or how does
they mail
that?
them to you.
How does that work?
You call up and you set up a credit card with them. But you do have to have your doctor send the prescription along
Sure.
to them in order for you to get it, and then they'll keep sending it to you every month.
How do you go about shopping for for drugs in Canada? How does that work? I mean, is it like the internet, or how do
Yeah,
how
pretty
do you
much
how do
a
you go about it?
website,
Because obviously
yeah.
it's international, so that's why I didn't know if there are rules when it comes to purchasing types of things and that. You know, one like I'm assuming the same thing could probably be a lot more expensive here than it is in Canada.
Well, they don't have. A lot of times they don't have the prescription. They have a generic there. That's
Okay.
what is it? What is it?
For Eliquis, you mean?
Eliquist.
Okay.
I think it's L, something with an A.
Okay, so they just have different
Yeah.
types of generics that the
Yes.
cost is so much cheaper.
And we don't have them in the US
Okay.
Yeah.
by us yet.
Okay.
So it really helps that if they would call Matt can just tell them what he knows exactly the site. He shows them what the difference in the dollar amount will be that they pay in the United States compared to Canada, and he directs them in the right way.
There's really not a class to learn this stuff. Is there? If people want to know about this coming in, is there? I mean, or is it one of those things you just have to kind of do the research and talk to people, somebody like Matt or
Yeah.
you both if they have it, or how does somebody become versed before they make that phone call to Heiar Insurance?
We used to have seminars,
sure.
yeah. But right now, I think, the best thing is just to call us and we take an intake sheet, get a little information. There's no charge to meet with Matt or Sandy, or myself. And so it's a free consultation, and just come in and get an idea of what your options are. And
Yeah, he does Social Security for people.
Sure.
He'll sign them up.
Yeah.
I mean, they can do it themselves, really, but to understand it more, they go to Matt Matt or Sandy, and they sign up for Social Security, and that's where they go through ACA. They could have done it themselves, but Matt and Sandy can put them into plans. That
health insurance for people under 65
Yeah, the Affordable
is
Care
the
Act.
Affordable Care
Yep.
Act.
So, how much traffic do you get into your office for Affordable Care Act insurance? Is it pretty busy there
It's
as well?
busy. Yeah, that is really picked up over the years.
What is that process like? What are the choices? You talk about having so many different choices for different plans. When it comes to the Affordable Care Act, what options do people have?
Leanne
is
is
it
on
Leanne?
the-
That's you can.
Yeah,
is that you?
you're on the Affordable Care
Is
Act.
it-
Yeah.
Okay.
You have to find out by the plans that are available in your area.
Okay.
Given your zip code, and then it's based on your income.
Okay.
So, and there's a set rate where you can the income will direct you to having to go on the Affordable Care Act,
Okay.
or it would put you to Badger Care.
Okay. So you don't. Okay, somebody may ask, Affordable Care Act. You say Badger Care. What's the difference?
for Badger Care is done through the government.
Yep,
the
the state of Wisconsin, correct? Just so
Wisconsin,
people that weren't familiar with that, yeah, because that was
and
okay.
the Affordable Care Act is done.
Yeah.
You pay your different plans.
A federal program.
I think some
Yes,
people might
federal.
think that it's all tied to the same thing, but they're two separate
it's
things,
two
right? You
separate.
can be on Badger Care, you can be in the Affordable Care. How does it determine if you can be on Badger Care?
Your
Income.
Is it your so it's 100% on your income, whatever what you're at?
correct on both of them actually. I mean, when you make too much for the Affordable Care Act, you may be paying 100% of your premium based on what you make for income.
Okay.
And it's based on your gross income.
Because I think a lot of people, so there are people, I remember when I was younger, you'd hear about Badger Care. It was always for like maybe people who had kids and things like that, but it can be just adults, single
Correct.
person too, end up being on Badger Care.
It could be full families, individuals.
Sure.
People who lost their insurance. Let's say they lost their job. Call up and or go online and set up for Badger Care. You could call over to the county. They would help you with a lot of the different things. ADRC helps a lot with the fighting programs and things that people that the
Yeah, that's a
elderly
great
can go on.
resource.
Yes.
In the county.
Yes.
All right, this is Senior Solutions with Heiar Insurance on 95.3 WBEV and Daily Dodge TV. You can give us a call if you have any questions. I'm sure you'd feel free to answer them, right, at 920-885-4446, or you can send us a text, 920-887-9595 here on 95.3 WBEV and Daily Dodge TV. So, Leanne, again, you talked about handling your part-time. So, like, do you do the kind of the same thing that Jill does, or do you have different responsibilities when
No.
you're at the office?
I do about the same. I ask her questions too, but
No, you're
I
you're
pretty
learning,
much- yeah.
but you're doing the same thing basically.
It was a lot when I started. But I went to school. I did go to picked up the classes to learn more about the health insurance through the state. Actually, I went to Kaplan and got my. I didn't get my license yet.
Okay.
I'm still debating if I want to do that part yet.
Okay.
Okay.
Well, what does it? You mentioned debating. What does it take?
Yeah, it's
Like, what types of things do you have? What types of things do you have to go through?
I went. The state test is not
Okay.
an easy test.
Okay.
right.
So you have to
Study and
yes.
read up on
and there's changes so much with the legislature laws.
Laws.
It's a lot, and you know how they change.
Yeah. No,
constantly.
probably changes every.
Yeah, they have to go through training. You go through training every year.
Yeah, every 2 years we have to have continuing education
You
to
have to have a
keep up
certain
our
amount of credits.
license. and
Okay.
Yep.
So
certain
how long
amount
of a process is that? Can it probably be different for every person? How they expedite together to get licensed?
Yeah, probably I would say on average it's a couple months, 2
Yeah,
months.
yeah, I
Of
haven't
just
gone-
reading it all through and practice testing and
Do you feel like what you guys do, you make a direct impact? You got to have a great feeling knowing that you make a direct impact on people, because they probably come to you, the great unknown, the cloud of unknown, as you get closer to that, 65, and you can kind of help put people at ease, because it probably is a high stress time for
Yeah.
for almost everybody getting into if they're not like already in the business, and you're there to kind of help them through the uneasiness and the uncertainness of what they're doing.
yeah, exactly. You put it exactly right. Where sometimes they just walk out of the office feeling like, oh my gosh, I feel so much better. And this was just weighing me down of worry. And then just, one less thing they have to deal with right away with retirement.
Do you tend to have a lot of people that ask a lot of questions, or I will be the person, and I've told Matt this, that'll just be like, tell me what I need and I'll sign my name on the sheet? What percentage do you get? A lot of people that are asking lots of questions, or they just say, Matt, Sandy, Jill,
Yeah.
Leanne, I trust you?
No, I think for the most part they do have questions, but they've heard from their neighbor.
Oh, my
that
neighbor
this
says
is-
I need this plan.
Yeah, right. And then at work, everybody said, go see Matt. And then people at work are giving them advice. And so I think and then you get a lot of mail, you get, it's starting when you turn 64 already.
Okay, it starts coming?
Yes, lots of it. And that's the other thing about mail. I would just encourage people to open their mail because when you do get your Medicare card, sometimes it doesn't say on the envelope, this is your Medicare card, but it accidentally gets thrown away because they think it might just be some marketing material.
Is that for privacy purposes? They probably don't want to make it too
Yeah,
obvious.
right. That
They do that also with your insurance cards.
Yeah, and I was going to
Those
say
might
the
be in a
same with
plain envelope.
insurance
Yeah,
cards.
don't throw them away. Look.
Yeah, open. So especially this time of year when you're waiting for cards for with your drug plan and with your new insurance plan, just open your mail and watch for that stuff.
Because I'm assuming it's like when you get towards like 64, you mentioned, is it like election season where you start getting, is your mailbox full every day of stuff
It's
from
terrible.
people?
I'm getting.
You're
I'm
already
63 and I'm starting to get stuff already.
I would have never guessed.
They find you, as Matt likes to
Yeah,
say.
they do.
Yeah.
Okay, but that can be kind of intimidating as well. So when you all of a sudden you open up the mailbox and you're 63, 64 and you see a stack of 15 things, how do you even begin to do you just vertical file them, making sure they're not your cards? Do you look at them, or how do you end up from your perspective managing all of those types of things that you get?
We have people that save them, and then they come into our office.
With the stack of
with the
100?
stack.
And then you'd be like, junk, junk,
Yeah.
junk, junk,
Yes.
junk, junk, junk.
Yes.
Yeah.
I know we once had somebody ask too on that, how do they get your address? It's all public record, isn't it? And they know dates of birth and they just...
The government can find you. Yeah,
Yep,
exactly. And it's all public information.
So is it government that sends you, or is it private companies that are sending you stuff, like different plans and things like that?
It's a little bit of both, yeah. But it's all based, I think, through, government records that they have access to. And when you're turning, it's just out there for the marketing material to be sent. And yeah, there's no way to stop it, I don't think. You just kind of, glance at a few things. You can kind of tell marketing material, always say along the bottom, too, this is not affiliated with any government agency.
Sometimes they get pretty sneaky on that stuff. And
Yeah.
they have stuff that looks kind of official, isn't it?
Right, it does.
Emails,
Yes.
phone calls. That's really terrible for the elderly, where they
Yeah.
get these phone calls. Well, I'm already, I already have the coverage.
So I guess we'll talk about that then. I guess we're talking with Leanne Schultz and Jill Bennett from Heiar Insurance, Senior Solutions on 95.3 and Daily Dodge TV. What are red flags that when people start getting all of these things of things that are legit? How do people decipher out what is legit and what is maybe somebody, either a marketer trying to not necessarily scam you, but just trying to get your business in maybe a nefarious type of way?
Yeah, I mean, emails.
Yeah, we've had a couple people that signed up for insurance and already had insurance because the ones that call, they make it sound like, well, you don't have insurance.
Okay.
So they have to sign up again. You can't have two of them. You can only have one. So we've had it that we had to cancel one for some of these people.
What happens if you have two?
You can't.
That's what I'm saying. You cancel. Obviously, I get the red flag somewhere,
Yeah,
and then you have to
one
figure
of-
out which one you're supposed to be
cancel
on.
The other, if it's
Are there
an
like
Advantage
penalties
plan.
for having like all of a sudden signing up for a second one? If you didn't know,
That's a good question. I
Yeah.
don't know about not a penalty as such, but you would be either double paying. If you had
Okay,
a
yeah, you wouldn't-
supplement,
yeah, you-
you'd be paying for
Yeah.
two. But I don't believe there'd be a
Okay.
penalty. But sometimes it is hard to get it taken away, or get it to end the other plan. It
what
can be.
percentage of people change plans? Like when you go through your fall into winter, what percent of people are like, I just want to stay where I'm at, and what percent of people? There are a lot of people that do have to change every year just because of how things are reshifted around from year to year.
I think what they change in is their prescription drugs would be the biggest
Yeah.
thing. But we go on the government website and see which one's the cheapest for the drugs. They let us know what drugs they take, and then we go underneath the government Medicare site, and we can find the different plans that they can pick from. And a lot of times they are on the same plan, but we try to find the cheapest plan for them.
So
Yeah.
when you're talking about insurance, you talked about that we're non-Medicare, Social Security. Does Heiar Insurance deal with other insurance as well for people? Like, is it all Affordable Care Act type stuff, or?
No, we have life insurance.
Yeah, that's what I'm saying. So you
Yeah.
offer life. Can
And
I
then-
talk about that? Like how people go about taking in life insurance and what they should be looking for when they call you up or send an email or set an appointment about life insurance.
Life and dental. We have
Okay.
dental insurance,
Okay.
which is separate. Your dental insurance through group is usually much better than what you can buy through.
And vision, too.
Yes,
with
and
the
vision
group.
also.
So
Because,
we-
when you're on Medicare,
Yeah.
Matt always say.
Yeah.
They don't
They
like
don't care about your eyes, ears, or teeth.
Is that what it is? Okay, so
Yeah.
so that's you're basically on your own for eyes, ears, and teeth.
Yes.
Basically, yeah. I mean, the Advantage plans have some benefit for dental, especially, but it's in this area of Dodge County. A lot of the dentists don't accept it, so you just want to double check with your dentist, and if you're willing to change dentists and go to one, you will have some benefit. But with supplements, yeah, they don't have. You'd have to get a separate dental plan, and there are plans available. It's just that you want to make sure your dentist accepts the plan you choose and know what your benefits are.
Sure, that's a matter of making a phone call or going on the internet and seeing who's accepting
Yeah.
certain types of things.
Exactly, or we can look it up through an Emeritus network sometimes, or different dental networks to see who's accepting what plan.
Is it mostly like seniors that are taking like dental and optical and such through your plans, or do you have people that are a little younger than that? They're looking for a plan. Maybe their insurance doesn't have dental or optical involved in it.
Yeah, not too often. I
Okay.
think most of the group insurance is pretty good about offering some dental. And does your plan, for instance,
Yes,
or have
yes.
dental
I'm
and
pretty sure.
vision?
I'm a guy that I just pay whatever they tell me I have to pay. Yes, no, we have some dental insurance.
Yeah, some,
with our-
yeah.
No, but like for example, though, my wife works remotely for a company that is not in the region. So the biggest thing for us then is that trying to find doctors and dentists
That
that
accept
are in the network.
in the network.
Then the network, so you can pay a little bit more. So we're paying for a dentist that's a little bit more. I'm out of network because I have like one choice of a dentist anywhere within like 30 miles.
That's kind of what
here.
I remember too from group insurance.
Yeah, and so
was finding the
so I'm
dentist.
paying a little bit more to go kind of keep going to the place where I was at. But the same thing goes with like optical and things like that. You're right. You have to
You gotta
search
find
around
someone who's in the network.
who's in the network. Otherwise, sometimes it's very minimal. But sometimes it is.
It is a lot more.
It makes
sometimes,
a difference. So you have to
right.
kind of figure that out. And that's again where when you're looking with Heiar Insurance, if they're talking to Sandy, you, Matt, Leanne, you guys will make sure people get through and find the right plans that are most affordable, and also because you don't want to be in a plan that you think is the most affordable, correct, but it also doesn't cover your needs of what you need to get by and live your quality of life.
Yeah, knowing your benefits.
You have to look at the fine print because there are times that with the dental, it's a pretty good. The premium's not so bad, but then you have to look in the fine lines where crown's going to cost you this, or you have to wait a certain amount of years before you can get a crown, and you have to watch that.
Waiting periods.
Yep.
Yeah.
Usually it's 12 months a lot of times for major.
Major dental work.
Yep.
And that's why it is important to if you have questions, you're not sure, to contact Heiar Insurance, because if you just go with my neighbor, my neighbor Ralph said I need this one, I'm just going to go meander my way through the sign up process. You have no idea,
Right.
and Ralph has no idea if that's what's good for you in your plan.
That's exactly right. Yeah, if you put it exactly the fact that you really want to make sure and give us a call and we can, help you look through it or review it.
Typically, when somebody makes an initial consultation, a call that wants to discuss their things, typically, number one, what do they need to bring to those appointments? How long do those initial appointments usually last, and what do you look to accomplish?
Well, this year we made the ACA. Most of them was but half an hour.
Okay.
That
But
was
when
to
it's
update them.
right,
Yeah,
just update
a new
'em.
one would probably be 45 minutes. Yeah.
But to start someone from fresh, we give them an hour because a lot of times people would come in just for Social Security, have them we'll sign them out for Social Security, and then they look at the Medicare plans right away. So we go through them. They may not need them at that time, but at least they know what type of plans we offer. And then they might have some type of 457 or a 401k or something, and Matt can help them with that. So it does take longer.
Sure.
But what they should bring, usually I like to tell everybody, bring your Medicare card. If you've received your red, white, and blue card, bring that along. Bring your banking information, the routing number and account number, so that if you do choose a supplement, you have the payment information. List of your medications. We always like to make sure medications are covered on both supplements and through the Affordable Care too. We've been running into some people who signed up for an Affordable Care plan on the marketplace, and we signed them up perhaps, but an expensive medication then is not covered. You know, we didn't realize they were taking Eliquis because they didn't, have their list. But yeah, medications. And always have your cell phone with you because anytime we want to log into one of the government plans, they're going to send you a text to verify your identity.
Their income? That's definitely because
for the affordable care under 65, it's based on income.
Yep.
So when somebody would call in or they make the initial appointment, how far out should they start thinking about this? Like if somebody's like, I'm going to be turning 65 sometime in the near future, when do I make that first call to meet with somebody at Heiar Insurance to make sure you have it ready to go once you hit that magic number?
Yeah, about 3 months before you turn you can sign up 3 months before, the month of, and then 3 months after. So, but some people, they want to come in 6 months before, and that's okay too, because they just want to, again, feel comfortable, feel educated, feel ready, and not be like anticipating this and uncertainty of it. But
Typically, for making a phone call, how far out can you get in? Can you get an appointment? Does it depend on week to week? Where I know if I'm going to need a week out, 2 weeks out, 3 weeks out from making that phone call to getting in to talk to somebody?
most times we can get you in pretty much that week or week after. No, not that week, the week after, I would say. But during, of course, busy season, it was a lot busier. But when
we had to wait a little bit longer for some of them for busy season.
But right now, if you called today for something, Matt's of course gone next week, but then the week after we would have time.
Took off, right? He took a vacation when it's 50 below zero.
You picked the right weekend coming up. It's going to be cold.
It is.
That cold front is going way down that area.
Okay.
Is it going to hit even to
No,
Mexico? I think Florida, though, will be affected, they said,
think,
even
well, Texas is supposed
and
to be.
Florida.
Yeah.
Yeah.
I had a friend that was fishing, went down south fishing, and it was like 35 degrees or 42 degrees. I talked to him yesterday.
He wasn't too happy about that.
Well, it is what it is. It's not 15 below zero. But so, what are the phone numbers for Heiar Insurance? How do people get in contact with you if they want to get the ball rolling on something, or they just have questions?
Oh, it's 920-887-0580.
And so, when you're Jill and Leanne, when you're not solving people's problems and getting them signed up for various plans and such, what do you do in your spare time? What do you do outside of the office? What do you do for fun?
Oh, I like to work out. I've been a fitness instructor for 30 years as well. I retired around COVID time, but I like to exercise and cook. I guess cooking.
What time are you up every morning? Are you an early morning riser to exercise?
I don't know. If it's not early, 6:30. I'm up.
That's not so bad.
No, it's not early, but I exercise at home. I do different workouts that I have set up. A lot of my supplement has a Silver and Fit, so I can go to the Y or Get Fit or some other clubs. So I'm using that benefit. What do
you like to cook?
I like to make like chilies or lasagnas, things that I have leftovers for.
Question here: do you put noodles in your chili?
I do.
Then it's soup.
Okay.
Okay,
you're
we're gonna
right.
fight over that.
Yeah, you're probably
That's my
right.
chili too.
What do you have noodles in your chili too?
Yes, but you know why? It's because
Why?
when you come from a family of 10,
Okay, yep, you have to.
you have to make.
I hear
You have
you.
to fill it. You have to do it some way, and that's what I came from.
Yeah. I have a distinct chili recipe that I have, and my wife just throws stuff in.
That's what I kind of do
You just
too.
throw stuff in, and hopefully there's some sort of meat in there, and then you can let it boil and have it look red and it's chili, right?
Yeah, right.
No, I have a garden, and I had my own
Veggies in
tomatoes.
there.
Okay.
Yeah,
all
a
that
lot
stuff.
of good.
I can.
So you're not gardening this time of year, are you?
No.
No.
But you can, so that's
yeah,
great. You
I
have
can.
things to cook with in the winter.
Best
then.
chilies when you use your homemade tomato juice.
Oh, is it? Does that make it?
Just like your Bloody Marys.
Okay, you have homemade tomato juice and the Bloody Mary.
Yeah, because I have it a little bit spicy in my tomato juice.
Okay.
And then, I like that.
So what do you like to do, Leanne, in your
Right
spare
now
time?
I'm helping my sister with all her moving. I work part-time at Johnny's.
Uh-huh.
And then I work, that's my brother.
Okay.
And I know you know who they are.
Yes.
And
Who doesn't, right?
That's
Yes,
right.
and
And everybody knows Leanne
Yeah.
too.
then,
I mean,
because I worked all over. I mean, down there, and I used to work at Kirsch, and I used to work at.
You've been all over.
I have been. I've been and Kmart. Remember Kmart?
See, I came here in 2016, so I know Kmart was where now there's a clinic over there, right?
right.
Yeah.
Yeah,
is
so
it
I do
still-
know that, but no, I was pre Kmart and post Kmart in Beaverdam. That closed in like '83 though.
Was it?
Yeah, I
Just
think
right
Kmart
after-
was only here for like 4 years.
Right after that, I went to Kirsch, and then from Kirsch, I went to the county, and now I'm at Heiar.
Well, awesome stuff. Again,
Yeah.
I appreciate you both coming in here today.
Yeah.
Jill Bennett, Leanne Schultz. Again, the phone number for Heiar Insurance if people want to get in touch and make an appointment or just ask questions.
Call us at 920-887-0580.
All right. Thank you so much for joining us here today. The following program was a paid program. Opinions expressed on this program are those of Heiar Insurance and not necessarily those of Good Karma Brands, Beaver Dam. Wally Lukashinsky, appreciate him pushing the buttons back at, I guess, up in the radio studio. Leanne, Jill, thank you so much for coming in.
Yeah, you're
Thank you for
welcome.
having us.
You have
a great
been
weekend.
watching and listening to Senior Solutions on 95.3 WBEV and Daily Dodge TV.